We now want to bring in Jody Hicks. She is the president and CEO of Planned Parenthood Affiliates of California. Jody, thank you for being with us on such a busy week for you. Gina was just talking about this constitutional amendment. That's the big news story of the day. California's legislature saying in November, on the ballot, everybody's going to be able to vote on this idea of enshrining a right to abortion into the California Constitution. Why is that necessary in this state, which is so overwhelmingly pro-choice and has so many overwhelmingly pro-choice leaders right now?
Well, let me say this. At the national level, people across the country are overwhelmingly also pro-choice and overwhelmingly did not want Roe v. Wade to be overturned. And here we are today. Still reeling from the outcome of that decision. And so I think if we've learned nothing else from that decision, from all of the opinions that we've read, is the right to privacy is no longer safe. And so here in California, what we can do is put in our Constitution, be very explicit that here in California, people have the right to reproductive freedoms, including abortion and contraception.
All right, so that issue will be on the November ballot. Since we last spoke to you, I know you were on our air on Friday, really soon after this decision came down. Some days have now transpired. Abortion is either severely restricted or illegal in many states across this country. How has that impacted Planned Parenthood? Have you seen a direct impact where there are women who are coming from out of state already to California to get an abortion? What does that look like?
Well, I think, and I think I talked about this before, it's important to remember that we have been seeing this impact and we have been preparing since September when SB 8 went into effect and Texas instituted their ban, and the Supreme Court, really their inaction allowed that to become law despite the fact that it was unconstitutional. And so since then, we've had that fallout. It's really a domino effect for when one state falls and the next state is impacted in the next state. And so we have been seeing somewhere around 1,500 patients a month from folks coming from out of state. And so I think it's a little too soon in the coming days. I've heard anecdotally already about patients that are coming, even some I heard today with severe health conditions that now have to travel with a severe chronic condition and having to help navigate that process for how they get here. So we're hearing those anecdotally, but I don't have the data for what the last couple of days means, but we know we'll continue to be impacted, and that's why we've been preparing for that day since September.
Just for context, when you say 1,500 a month from out of state prior to this, what was that number before?
So that's a great question. It was not 1,500 a month. I think it was somewhere around 7,000 in one fiscal year. A lot of that was due to the pandemic as well, and some things that were instituted in each state about what was essential services. But that number has increased per month since Texas went into effect.
So since this ruling came down, a lot of people have gone to your website. The first thing they see on your website is an ability to donate to you. How much money have you raised since this happened on Friday, and what does that money go to for people that may be considering donating?
Sure, and I don't have that total. There, we are affiliates that are separate affiliates, and so if I can encourage people to donate, that goes directly to services, is to donate to their local affiliate, and you can find that on the website. It is each, Planned Parenthood Affiliates of California, we represent 7 affiliates throughout California. Those affiliates run over 100 health centers throughout the state. And so if you donate to a local affiliate, you are absolutely donated to services and the health centers that they operate. The other thing I would say is there are also abortion funds across the country. For California, it's Access Reproductive Justice, and they are the organization that really does that practical support, so helps patients navigate whether that's travel or lodging or things like that. And then, for us here at the state level, we certainly support and our affiliates and do the work at the statewide level. But for folks wanting to donate to health services, definitely go to your local affiliate.
Planned Parenthood has been in existence for more than 100 years, which means, of course, that about half of your existence was pre the 1973 Roe v. Wade decision and ruling. So I'm curious to find out if you, sort of the lessons learned from pre-1973 and how you're falling back on those lessons as we move forward to today.
Sure. I mean, I think one thing that I keep saying is though we are an organization that has been around for 100 years, for many of us, this Roe protection has been around really for generations. You know, I have not lived a life that I remember as pre-Roe, and many leaders are sort of grappling with what a post-Roe reality looks like. What I will tell you is technology has changed. There are things now like medication, abortion. There are ways that people are finding their way to those services. It's one of the biggest services that folks like Planned Parenthood provide for patients. But having said that, you know, we have to help people travel to outside of the state they live in right now. And I think we're working very closely with a lot of the organizations that do that, including our own affiliates. Many of them have part of the services that they provide. We're also hiring abortion navigators, patient navigators, that really is their job. If you call a health center, they help you with what is the closest airport, how long does it take to get from the airport to a health center. So technology has changed, times have changed. What hasn't changed is 1 in 4 women in their reproductive lifetime will need or want to access an abortion service, and that doesn't change despite what policymakers are doing across the country.
Jody Hicks, thank you so much for sharing your perspective. This conversation is going to continue. We see that picture of Kamala Harris behind you. They know there's a lot of people that are hoping the Biden administration might do more going forward. That'll be interesting to talk with you about in the weeks and months ahead, but we appreciate you coming on tonight.
Thank you so much.